take a moment to subscribe our channel, then tap the bell icon so that you will be the first to know when we post new video. 6-week pregnant, what to expect? Your baby is now 4 to 7 millimeters long and will develop his or her face this week. Top of your list this week should be booking your first antenatal appointment with your GP. What's my baby doing at 6 weeks pregnant? You might be feeling the full effects of those early pregnancy symptoms. Hello, morning sickness, but the good news is, the folds of tissue are developing that will soon become your baby's face. At the moment, there's tiny openings that will turn into a mouth and nostrils in a few weeks. There's also dark patches that will eventually turn into eyes, and small folds on the side of your baby's head that will turn into ears. Although your baby's limbs are just buds that will develop into arms and legs, there are tiny signs of that will grow into fingers and toes. The spinal cord is also developing rapidly, but at the moment, it still resembles a tail. Your baby's heart will also start to beat around 110 times a minute and can actually be seen on an ultrasound from this week. What is my body doing at 6 weeks pregnant? Your kidneys are becoming more effective of running your body of waste. Although you probably won't look any different from the outside, you might be feeling queasy, bloated or craving foods you've never even wanted before. Other early signs? You'll probably need to pee every 5 minutes, especially when you're trying to sleep. Luckily, this pressure will be relieved once your uterus rises at the beginning of trimester 2. Although your constant need to pee might be annoying, do not stop drinking, your body needs it. Instead, make sure you lean forward on the toilet to ensure you've emptied your bladder each time. Your stomach muscles relax. During week 6, the muscle at the top of your stomach relaxes to make room for your growing bum. Before your new arrival, this would prevent digestive juices from backing up, so the bad news is, the chances of getting through the next 8 months heartburn-free are nearly zero. The good news is, you can minimize the symptoms by slowing down when you eat, so take your time. Your uterus expands. Your uterus is getting bigger, but did you know that your womb will actually increase up to 1,000 times its normal size during your pregnancy, so this is still very early days. The amount of blood in your body increases. This has probably already happened, and isn't something you're likely to notice. Why is this happening? During these first few weeks of pregnancy, you'll have an increased blood supply to your uterus, breasts, kidneys and skin. Common symptoms to look out for. Breast tenderness. You're not imagining it, your boobs are getting bigger and your nipples are pointing out more. They might also be feeling really tender as your body gets ready to breastfeed. Fatigue. Your body is growing a baby, so it's bound to be exhausted. Listen to it and feel free to cancel those dinner arrangements and get an early night. That said, as much as you might not feel like it, try and fit some exercise in, perhaps a gentle walk or yoga class. The endorphins will help you feel better and it might help you get to sleep. Nausea and vomiting. Whether you're feeling a little sick at the sight of your partner's scrambled eggs, or you're throwing up your breakfast, lunch and dinner, relax and remember, this is one of the most common signs of pregnancy. If you are being sick, snacking is key. Bloating. This one is down to the progesterone that's flying around your body right now. Remember to eat lots of fiber and drink plenty of water to avoid getting constipated, which will only make that horrible bloated feeling worse. What should I be doing when I'm 6 weeks pregnant? Book an appointment with your doctor. As we mentioned above, now is the time to book that first appointment with your GP or a local midwife so you can discuss your antenatal care options. Your first of many prenatal checkups, your doctor will give you a thorough check, including a pelvic exam, a smear test, unless you've had one recently, and a blood test. You might be asked to give a urine sample, which you probably won't have a problem providing, and this will be tested for glucose, protein, red and white blood cells and bacteria. Another thing to expect is a lot of questions, so do your homework. Not only will they ask about your own health history, but also ask your mother if she had any difficulties or complications when giving birth. Remember to make a list of questions for your doctor and ask them, no matter how silly they may sound. Stop eating certain seafood. Avoid shark, swordfish and king mackerel, but don't worry, you don't need to cut out fish altogether. According to pregnancy guidelines, you can still eat 12 ounces of well-cooked shellfish, canned tuna, salmon or cod a week.